Alright, so today we will be starting with general chemotherapy. This is the unit number 4 of veterinary pharmacology, third year BVSc and AH. Alright, let's start. So chemotherapy, if we try to understand this word chemotherapy, it is made up of two words, chemo and therapy. Okay, chemo and therapy. So chemo means chemical and therapy means treatment. So in simple terms, we can define chemotherapy as the treatment of systemic infections or malignancy by using pure chemicals. Okay, but if you want to understand or define chemotherapy in a much specific way, then this is the definition. Chemotherapy is the treatment of systemic infections or malignancy by using specific chemicals that have selective toxicity for infecting organisms and malignant cells with no or minimal effects on the host cells. Okay, if you try to understand this definition, it simply means that chemotherapy is a treatment of systemic infections. Okay, and malignancy. So malignancy, that is cancer or neoplasia, by using specific chemicals. And the property of this specific chemical is that they should be selectively toxic. They should have selective toxicity. That is, they must be maximally parasitotropic and minimally organotropic. That is, they must have maximum affinity for parasitizing organism or microbe or parasite or malignant cell, but it should have least affinity for the host cell. Okay, so that is what is written here. Selective toxicity is an essential property of chemotherapeutics by which it selectively targets the pathogen and malignant cells with no little effects on host cells. Okay, so this we can in one line or in one phrase we can describe it as follows: maximally parasitotropic, minimally organotropic. Okay. Next we have got basis of selective toxicity. So on what basis is selective toxicity dependent, or on what basis is selective toxicity dependent? So selective toxicity is dependent on the variation in structural components and metabolic processes in between pathogens and malignant cells. Okay, so selective toxicity, how are drugs able to distinguish that okay, we need to kill this cell and we don't need to cause any harm to this cell? Because there are variation in structural components and metabolic process in between pathogen and malignant cells. Okay, so structure, metabolic process, all of these are different in case of pathogen and malignant cell. That is why this is a basis of selective toxicity. Okay, so this is a general point. Antibiotics constitute a large part of therapeutics. Okay, we all know this. Let's move ahead. Alright, so now we're talking about the drugs acting as chemotherapeutic agents. So there are various classes of drugs which act as chemotherapeutic agents. For example, antibiotic, antiviral, antifungal, also called antimycotic, anti-neoplastic, antiparasitic, and antiseptic and disinfectants. Okay, these are 6 major classes of drugs which act as chemotherapeutic agents. Now we will understand this point in mechanism of what is the reason behind this point later when we will discuss anti-neoplastic and antiviral drugs. But for right now, both anti-neoplastic and antiviral drugs exert poor selectivity. That is, they exert similar effect on both host cell and viral or malignant cells. Okay, so these drugs harm both the cells. That is, they will harm the parasitizing cell, that is virus. It is not a cell, but it will harm the virus, but it will equally harm the normal host cell. Secondly, anti-neoplastic will harm the malignant cells, but it will similarly harm the normal cells. Okay, few historical points. So Paul Ehrlich, he coined the term chemotherapy and he introduced the concept of chemotherapeutic index. So he is regarded as the father of chemotherapy. Next we have got DOMAG, D-O-M-A-G-K. So he discovered the antibacterial activity of a dye, Prontosil red. So there is a dye that is called Prontosil red. He discovered the antibacterial property of this dye, and this discovery paved the way for the discovery or creation of sulfonamides. Okay. And sulfonamide, as you know, is one of the most important group of antibiotics which we have today. Okay. Next we have got Alexander Fleming. Alexander Fleming, he discovered, or you can say he isolated penicillin from the fungus Penicillium notatum. Okay, but the current commercial production of penicillin is done from Penicillium chrysogenum. Okay, this is a basic point. Next we have got Waxman. So he obtained streptomycin from Streptomyces griseus. Okay, so these were some historical points. Let's move ahead and now we'll define what are antimicrobial agents, which can be written in short as AMA. Okay, so these are the synthetic or natural drugs obtained. These are synthetic or naturally obtained drugs that are used to kill the microbes or inhibit their growth. Okay, so what are antimicrobial agents? These are the synthetic and naturally obtained drugs. Naturally, for example, plant source, fungal source, microbial source, that are used to kill the microbes or inhibit their growth. Very simple. Antimicrobial agents are used to kill the microbial growth or inhibit their growth, and these are obtained from either natural source or they are synthetically made in the lab. Okay. So now we'll study classification of antimicrobial agent. Antimicrobial agent can be divided into various classes on 4 bases. Okay, so there must be some basis according to which you can classify antimicrobial agent into different classes. There are 4 bases. Okay, based on antibacterial action, based on antibacterial spectrum, then we have got based on mechanism of antimicrobial action. Okay, this is antibacterial action and antimicrobial action, and lastly we have got on the basis of source. Okay, all right. So let's now discuss this. First is classification on the basis of antibacterial action. So we have bacteriostatic and bactericidal. Okay, so bacteriostatic includes sulfonamide, tetracycline, chloramphenicol, erythromycin, lincomycin. So mnemonic for this which I have made is this STCEL. Okay, and this will make sense when we'll go to check this mnemonic. STCF, and this is STCE. So kind of your similarity, only E and F is different. So that is why I made this mnemonic. Okay, so STCEN EL, so sulfonamide, tetracycline, chloramphenicol, erythromycin, lincomycin. Okay, bacteriostatic, as the name suggests, they will stop or inhibit the growth of bacteria. Bactericidal, they will kill the bacteria. Okay, so it includes these drugs PCS, KBC. Okay, so PCS, that is a mnemonic, so that can be learned by penicillin, cephalosporin, streptomycin, kanamycin, colistin, bacitracin. Okay, penicillin, cephalosporin, streptomycin, kanamycin, colistin, bacitracin. So these are drugs under bactericidal, having bactericidal action. Okay, now we have got on the basis of antibacterial spectrum. So we have got narrow spectrum, we have got broad spectrum. So first, if we discuss broad spectrum, the mnemonic as a broad spectrum means they will be acting against both gram positive and gram negative bacteria. And this include STCF, that is sulfonamide, tetracycline, chloramphenicol, fluoroquinolones. Okay. Now narrow spectrum, either against gram positive or either against gram negative. So again gram positive we have got, against gram positive we have got penicillin, erythromycin, lincomycin, bacitracin, pleb, PLEB. Okay, penicillin, erythromycin, lincomycin and bacitracin, that is pleb. And against gram negative can be learned by the mnemonic GPS. Okay, GPS, we all have GPS in our phone, all of that. So gentamicin, polymyxin B and streptomycin. Okay. Next we have got on the basis of mechanism of antimicrobial action. So how are these drugs exerting their antimicrobial action? How they are able to destroy the microbe or inhibit their growth? What is the mechanism behind that? What they are altering in the microbial cell so that microbe is not able to grow or it is being killed. Okay. So first mechanism is by inhibiting the bacterial cell wall formation, or we can coin it as follows: by causing the breakdown of bacterial cell wall. Okay, they will either inhibit the bacterial cell wall formation or they will cause the breakdown of preformed bacterial cell wall. Okay, example here can be PCB-CV. Okay, physics, chemistry, bio, CV. Okay, so PCB-CV, this is a mnemonic actually. So it includes penicillin, cephalosporin, bacitracin, cycloserine and vancomycin. Okay, penicillin, cephalosporin, bacitracin, cycloserine, vancomycin. Okay. Last we have got, second we have got by changing the permeability of cell membrane of bacterial cell. Okay. So what this basically means is these drugs when administered, they will change the permeability of bacterial cell. That is, they will make the bacterial cell, they will cause the leakage of substances from the bacterial cell. Okay. So example are polyene antifungal antibiotics, that is nystatin and amphotericin B. Okay. Then we have got the drugs which inhibit the synthesis of ergosterol in the fungal cell membrane, that is itraconazole. Okay. Then we have got by interfering with the bacterial protein synthesis. So now bacterial protein synthesis can be inhibited by various ways. Okay, bacterial protein synthesis can be inhibited by